member, kapisanan ng mga broadcaster ng Pilipinas.
But more than these, we need a few more medical supplies and medicines to make sure that we're safe and protected, not just from COVID-19, but from a number of common illnesses and injuries. But what medical supplies should always be kept in your home? What are these items for? And how and when should we use them? And when is it time to go see a doctor for professional help? Today on the show, we'll talk about the essentials for a well-stocked medicine cabinet. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk, where your care comes first. It used to be that when we get hurt or don't feel well, our first inclination is to go see a doctor. But it isn't always necessary. And these days, because of the pandemic, we hesitate to go to a hospital. Let's welcome our guest for today. With us is Dr. Camille Macalalag Santa Cruz. She's an emergency medicine specialist at the Rizal Medical Center and Asian Hospital and Medical Center. Also with us is Dr. Pilar Elena Villanueva. She's a family medicine specialist from Healthway Medical Clinic. Now, the first thing that we can talk about are minor cuts and bruises, because many minor injuries and illnesses can be treated easily at home. And among them are, as I mentioned, a cut or a scraped knee for that matter. So these can happen anytime, accidents can happen. Now, the first thing to do is to clean the wound with clean water as well as soap. That's very handy. And after that, you can apply cleaning solutions after that. Now, Dr. Cams, what are the types of cleaning solutions na maganda para sa minor cuts and bruises? Let's also talk about how different each one is.
If pre-pandemic you've encountered scraping your knee or having a wound and rushing to the ER, you'd notice na yung mga doctors ang ginagamit pang hugas ng sugat is parang dextrose. But that's not dextrose, that's called normal saline solution. Okay? It's an isotonic solution. Pag sinabing isotonic, ibig sabihin yung composition niya is comparable to yung composition ng body fluids natin, lalo na yung salt content. Pero, like you mentioned, water is the most, the universal cleanser talaga. Pero when it comes to water, if you have a choice, use drinking water or potable water, just to make sure na medyo lowered yung risk natin for skin infections or for infections. And also, what's more popular now is yung mga antimicrobial wound cleansers. Pag sinabing antimicrobial, what comes to mind is yung povidone iodine natin or betadine, di ba? Also, agua apoxinada, hydrogen peroxide, lagi ang part ng mga emergency kits natin at home. Some pointers lang, when you use betadine or povidone iodine, we also use that in the hospitals. Even for surgeries, yan ang ginagamit panlinis, no? Kasi at any given time, meron tayong layer of mikrobyo talaga sa skin natin. So pag nasugatan tayo, that becomes a door for the microbes to come in. Mm-hmm. So pag ginamitan mo siya ng betadine, it's It's a broad spectrum antimicrobial. So, ibig sabihin, papatayin na yung mga pathogens o yung mga mikrobyo na pwedeng pumasok o sumuot na dun sa sugat.
Dr. Camps, what can you say about those who are used to using alcohol directly on the wound kapag nasugatan sila at yun yung panlinis nila?
So, buti na mention mo ang alcohol ever since, kahit nang maliit tayo, napakahapdinan sa sugat. It's actually used to clean intact skin, no? Pag tayo nag-disinfect ng kamay, halimbawa may nahawakan tayo, pwede yan. Pero directly on wound, it's a no-no. Kasi bukod sa it's painful, it's volatile as well, madali din mag-evaporate, hindi rin nabibigay yung tamang cleansing na supposedly afforded to you.
Of course, we have to put some antibiotic creams after that. We'll talk more about that later on. But I want to talk about naman yung pag-bandage natin sa sugat. So, if it's a small cut, small wound, a band-aid would suffice. But bigger scrapes, you might need some bandage or some gauze on the injury so it can begin to heal. Now, Dr. Pai, my question is, ano bang purpose ng bandage pag-bandage natin, pagtakip lang to kasi ayaw natin makita yung sugat? Or does it serve as a means of applying pressure to the wound to stop bleeding? What's the purpose of bandaging a wound?
Well, yeah, you're correct about the putting pressure because it helps in stopping the blood flow, for one. That's one of the things you want. But it also serves to protect the wound, especially in areas that are very exposed and prone to being touched or being exposed to other elements in the environment. But aside from that, it has been shown that by covering or protecting the wound, it actually enhances the wound healing. So mas mabilis tayong gumaling when we protect the wound or cover the wound.
Right. And to add to your list of items you need in your medicine cabinet, make sure you have a quality pair of scissors, maybe tweezers, cotton balls, and swabs readily available. Bear in mind, if the cut or wound is too deep and the bleeding isn't stopping despite applying adequate pressure, go see a doctor because you might need stitches. Now, cuts and scrapes often come with accompanying pain, but there are different types of pain relievers for different kinds of pain. Dr. Pai, what pain relievers should we keep at home and when should we use them? Headaches, for example, what can our viewers take for a headache?
Alright, there are actually several types of pain relievers. You have your oral medications, you have your topical medications, and it will depend on the cause, right? So for simple headaches, simple paracetamol might do. But there are also a type of medications known as your NSAIDs or non-steroidal anti-inflammatories. That would be your ibuprofens and mefenamic acids. But to take them, you have to make sure that there is something in your stomach. Because they can cause some stomach upset. So usually, I would ask the patient to just try the paracetamol at first.
Okay. Now, sometimes relieving pain doesn't require taking any form of oral medication or topical medication for that matter. A hot water bag or gel bag might just do the trick. Now, Dr. Camp, tell us when a hot water bag can be useful and what is the principle behind an increase in temperature in relieving some forms of pain?
These bags can be pain relief aids, no? So nakakatulong siya para maibsan yung kirot na nararamdaman. Pagka tayo na-injure, okay, our body has its normal healing mechanisms. It brings about different substances towards the area of injury. So mamamaga talaga yung area na yun, magiging swollen. Pagka ginamitan natin ng malamig, nagko-constrict yung blood vessels, no? So napipigilan yung agarang pag-swell ng area. At the same time, cold can also dampen the sensation. So, nakakatulong talaga sa pain.
And as a reminder to our viewers, whenever you're using a hot bag or a cold compress for that matter, always have a piece of cloth or something in between and don't apply it directly to your skin. Now, we have a good start to our ideal medicine cabinet, but there are other supplies we need to help with common problems such as stomach aches, cough, colds, and allergies. We'll tell you more after a short break. Your care comes first here on Net Talk Health Talk, only on CNN Philippines. Talk Health Talk on CNN Philippines. I'm Dr. Freddy Gomez. Today, we've been talking about what you need at home to treat common injuries as well as illnesses. But we want to point out that these treatments are only meant to provide relief for minor medical problems only. Be sure to see a doctor for more serious injuries or if the condition persists. Now, along with a well-stocked medicine cabinet comes the responsibility of using its contents properly. Dr. Pai, what should our viewers know when it comes to using their medicine safely?
Well, first of all, storage is very important. So you have to store them properly. They have to be in a cool, dry place. They should be kept away from pets and animals, and make sure that they are well organized. You know, some of the lalagyan of the medications, they are sometimes hard to read. So what I would do is place them in a bigger envelope or container and then write big letters on them and write what they are for so that there won't be a confusion when the time comes.
Now, Dr. Pai, when it comes to the expiration date ng mga medicines, of course, we want to avail of the medication before its expiration date. But what does the expiration date mean? Does it mean na toxic na ito kapag lumampas ng date na ito?
Oh yeah, good thing you mentioned that I also put the expiration date on all the medications that we have, because once it reaches that date, usually the potency goes away, so it's not as good as before, and sometimes it starts to disintegrate as well. So it's not really good to use anymore.
Okay. Now, not all medical supplies need to fit into your medicine cabinet, but should be stored nearby where they can easily be accessed when needed. Dr. Camille, what else should our viewers keep at home in order to prepare and assess or prevent a medical situation?
So other supplies would entail things that are easy to access, no, from department stores or whatnot, but you can keep them in your medicine cabinet. This includes petroleum jelly. It has very wide use, no. It helps seal your skin. It provides water protective barriers, no. You can use it to moisturize your skin. For burns, you can use it as well, no. It can promote healing. Of course, if you don't want to use petroleum jelly, then by all means, go get a burn ointment or cream, no, to supplement your medicine stock. Okay, when it comes naman for insect bites, no, there are a lot of insect bite ointments out there as well. Aside from that, Dr. Pai already mentioned your usual pain relievers, your medications for diarrhea, no, yung Hydrate.
Yes, good advice. And we hope we were able to help you get started on what you need to provide for yourself and your family with safe and effective home health care. With that, I'd like to thank our guest, emergency medicine specialist Dr. Camille Macalalag Santa Cruz, and family medicine specialist Dr. Pilar Elena Villanueva. Maraming salamat sa inyong dalawa. Don't wait until it's too late to supply your medicine cabinet. Educate yourself on home treatments and remember to use your medicines safely. I'm Dr. Freddy Gomez, and thanks for watching MedTalk Health Talk here on CNN Philippines.
Beso,